colleagues. Today's presentation involves 3 colleagues who will shed light on these questions. They will be speaking about equity in our definitions, what characterizes neighborhood disadvantage in different contexts. Our speakers in the panel come from different career perspectives, different geographies, and a different place in the trajectory of academic careers. The presentation will kick off with Seth Frndak. Seth is a PhD student in the Department of Epidemiology and Environmental Health here at UB. His dissertation examines the role of neighborhoods to predict environmental exposures such as lead, construct validity of neighborhood disadvantage measures, and the potential for neighborhoods to modify the impact of environmental exposures on child behavior challenges. Seth is joined with a couple of other mentors that he works with closely. Speaking after him will be Dr. Kasia Kordas, my co-director for Community for Global Health Equity, who is also an associate professor in the Department of Epidemiology and Environmental Health. She co-leads work in multiple settings. She works predominantly in international settings, primarily Montevideo, Uruguay. Together with colleagues from the Catholic University of Uruguay and University of the Republic of Uruguay, she has been developing a research program in pediatric environmental epidemiology to understand the cognitive and behavioral effects of low-level exposure to multiple chemicals in school children's life in their environment. Dr. Kasia Kordas works closely with the 3rd speaker in our panel today. Dr. Gabriel Barg is a titular professor in the Neuroscience and Learning Department at the Catholic University of Uruguay. He is the co-director and supervising psychologist for, I am afraid I might butcher the pronunciation, Salud MB Montevideo cohort. I'm going to let him introduce the name of the cohort, a study. Participating in these projects allowed him to study neurocognitive development of children from different points of view, focusing on environmental factors. From a neuropsychological perspective, he has studied the relationship between toxic metal exposures and the development of executive functions, as well as measuring electrical brain activity associated with inhibitory processes in children who are exposed to lead. He works closely with schools and community members to distribute information on environmental contamination and neurodevelopment. Collectively, our colleagues' work influences our understanding of how children's health is undermined in neighborhood environments, but at the same time gives us a pathway of how we might change that going forward. With that, I welcome you all here and we'll turn it over to Seth to begin his presentation. As Seth gets started, please note that I will be monitoring the chat. If you have questions, I will collate them. The presentation is being video recorded and will be distributed broadly to the audience after the fact as well. The web page where the presentation will be available is now in the chat function. With that, over to you, Seth.
Thank you so much, Dr. Raja. Thank you, Dr. Kordas, for inviting me to speak at CGHE. I really hope that while I'm talking, this will reflect some of what I've learned from collaborating with Salud Ambiental Montevideo with our collaborators in Uruguay. And I hope that this will be informative and helpful for many, as it's been for me. Just a quick outline of what we'll be talking about. I wanted to go over some thoughts that I had concerning our definitions of neighborhood disadvantage and applying those to different contexts. Dr. Kordas will then move on to talk about the collaboration and overview of Salud Ambiental Montevideo. And then we'll finish with a conversation with Dr. Barg about Montevideo neighborhoods. I wanted to start off with kind of describing why we talk about neighbor disadvantage with regards to health and why it's important. So this is a paper, a figure from a paper from Dr. Amy Kind, who did a lot of work with the Area Deprivation Index in the United States. You can see from this graph that as the Area Deprivation Index increases, so that means that there's more disadvantage based on how they've defined their index, the percent of the population with controlled cholesterol goes down. So this is just one quick example of how neighbor disadvantage is related to health. There can be many reasons behind why neighbor disadvantage is related to this particular outcome, but I just wanted to show this as an example. I did want to state very plainly that, especially in the United States, neighbor disadvantage is related to historical issues of racism and segregation. You can see here, this is demonstrated by the Partnership for Public Good. They published this picture of Buffalo, New York. You can see that there's a large amount of segregation where the east side is primarily Black. You can see kind of in the center, there's a large number of white population, and the west side is Asian, Hispanic, much more multicultural. Unfortunately, you can also see on the right of your screen that the number of elevated blood level referrals are much higher in these segregated areas. So you can see that elevated blood levels are higher in the east side, east of Main Street. And this is a problem not just in Buffalo, New York, but is a problem throughout the United States. I wanted to move on to talk about how we define neighbor disadvantage. So this book, Urban Poverty in the Global South, has been really important for me to think in thinking about my dissertation about what I mean by neighbor disadvantage. And they go through many examples that demonstrate what happens when you take something, take a definition from the United States, from Europe, and apply it to a setting or a context that's not appropriate. Not only can this affect our scientific inferences by misclassifying these kinds of exposures, but it can also result in poor policy implementation. So I wanted to give a couple examples from this particular book. One of the major cities in Tanzania, the official percent of the population that live in poverty is 18%. But 30% of households live in only one room, and 70% of the population live in informal settlements. So there's a disconnect between what we consider to be the official poverty definition and some of these other urban issues. Other examples include in India, while 40% of the residents live in poor quality housing, the official estimate is 2%. And then there's some other, here's another example from the World Bank. In 2001, there were 924 million people living in inadequate shelters, according to this quote. But the World Bank estimated 495 million poor. And then the dollar-a-day poverty line suggests there's only 291 million. So how we define these things affects so many things, and it affects policy, it affects how we do science. And it's really important that we take stock and time and think about these things before just applying any definition to other contexts. So I wanted to give kind of a practical example of what that looks like using our data from the Salud Ambiental Montevideo data set. So a lot a lot of researchers use what I'm calling the Samson definition. Samson is a sociologist. His papers are mostly based in Chicago, and the variables that he used in defining neighborhood disadvantage include percent of the population receiving welfare, percent below the US poverty line, percent unemployed, percent female-headed households, sorry, percent Black, and percent under 18 years of age. What can be a common approach is to then take the definition that has been used in the United States and apply it to another setting. So I thought to myself, I want to demonstrate this. So what would I have done if I took this kind of simplistic approach? I could use percent unemployed. I could use percent Black, although these are different populations, and I want to specify that, but I could use percent African descent, which is in a data set that we have. And then percent under 18 years of age. So I can use those three and then create a definition of neighborhood disadvantage. So I used factor analysis to do this, and I just wanted to show you what the distribution might look like in the city of Montevideo if I was to have done this. And you can see it's kind of unevenly distributed. There's not clear demarcations. And it's fairly normally distributed, which is an interesting caveat. But what if we used both a data-driven approach and a more informed definition of neighborhood disadvantage for Montevideo? So in a paper that myself and the collaborators for SAM recently published, we used many more indicators of neighborhood disadvantage, including things like school attendance, education, unsatisfied basic needs of the household, and included those in our definition. And this is what it looks like when you use that definition. So you can see that it's skewed, but there's a much clearer demarcation. So this more central area of Montevideo is understood to be a more affluent area. So that it tracks with what we know about Montevideo. And I wanted to demonstrate if we use percentiles, which is a common thing to do, quintiles. If we use quintiles from the core definition, the Samson definition that I used, and then the more nuanced definition that I'm presenting, you can see that there's quite a bit of misclassification that happens. So for example, if you just look at the highest quintile, which I'm calling high disadvantage, you can see that there's about a 10% difference in our sample classified as living in a disadvantaged neighborhood. So how we define neighborhood disadvantage actually does affect misclassification of that particular exposure. So, you know, when I was working on this particular paper, we wanted to see if neighborhood disadvantage was related to child behavior problems. So this measure that we used, and we did find some associations. So increasing neighborhood disadvantage was related to 1.37 points higher conduct problems, 1.56 points higher shifting problems. So that's when students or children move from one task to another, and about a 2-point higher emotional control problems. So it would have been great if I could just take those findings and publish it. But it was Dr. Kordas and Dr. Barg and the team in Salud and Montevideo that said to me, maybe we need to take a pause and think about what neighborhoods are really like in Montevideo. Maybe we don't just publish about disadvantage in a neighborhood related to behavior and not really examine it for ourselves and talk to people that live there. So questions like, do we really capture everything relevant to living in these neighborhoods? And what does it look like for people that live there? So this way of thinking is reflected in this article by Dr. Eve Tuck that I highly recommend. It's called Suspending Damage, a Letter to Communities, and she separates the difference between damage-centered research and desire-based frameworks. And this is something that we wanted to implement in our paper that we were seeking to publish. She clarifies that damage-centered research, while operating benevolently, as she puts it here, it tries to establish harm in a population in order to affect change, rather than in a desire-based framework, trying to instill the desires, the hopes, and empowering these communities. So just a quick example from her research, she talked about how it's often framed that students in the US that pursue a GED could either be making bad choices, are lazy, or unable to make wise decisions. This is kind of a damage-centered framework. Excuse me. But a desire-based interpretation reframes how you think about students pursuing a GED and says, well, maybe they're making the best choices they can based on the information available to them. Maybe they care about their futures, and maybe they want to exit from negative high school experiences, and this is their way of doing that. So she says GED as a gateway to higher education and employment, and also a gateway route for high schools. So this reframing of damage-centered research to a more desire-based framework is really important, and I hope that we were able to capture some of this in our research. So I was curious to know how many publications are out there that had a resource-based framework versus a problem-based framework. And here's some of the terms that I used in searching for that. And I quick plotted it in Excel, and we can talk about if I use the right terms or not in searching. But I think what was interesting was that in these early years, 70s to about the 2000s, there were not a lot, but definitely more articles published about neighborhood resources relative to neighborhood problems. And it seems like it was after the 2000s that there are this increase, dramatic increase in framing of neighborhoods as in terms of their problems rather than their resources. So the pilot study that I was fortunate enough to be a part of was called Mi Barrio. And our goal was to help describe neighborhood characteristics in childbearing in Montevideo. In Montevideo. So we recruited 10 caregivers that were already a part of the Salud Ambiental Montevideo study. And we asked them, we used photo voice. So what that is basically, we gave them cameras, and we asked them to go out and take pictures of things that mattered to them. Something that they wanted to convey about their neighborhood. And we didn't want to put any kind of agenda on what they would bring back to us. But we said, think about what you want to tell us about, what matters to you. Excuse me. And then we did follow-up interviews that were conducted in Spanish by Yanina Gallo. And they lasted about 60, 90 minutes. And she helped ask open-ended questions that asked things like, what's your neighborhood like? What's it like for raising children? Why did you take this photo? What does this photo mean to you? And then we used a qualitative analysis to understand and categorize these thoughts that the participants were giving into themes. So there were 4 main themes that we noticed. Those were things about physical disorder. So there was a lot of talk about deterioration in certain neighborhoods, and that was important. They wanted to portray that to us. But there was also a lot of talk about recreation, the importance of parks, the importance of playgrounds in raising children. There was some concerns over crime. And then there was a lot of talk about community resources, roads, hospitals, supermarkets, and churches. So just to go through some quotes that were kindly provided to us. This is a personal photo that I took while I was there, but this participant said they wish to improve the physical disorder in the neighborhood, but felt somewhat unable to know where to start to do that. Recreation was also another important theme. This is a picture of a park that I took. I want you to note the cleanliness and the updated resources that they have here. And from this quote, they talked a lot about how it was fun to spend time there. They often took their children there, and this is where they went to socialize. So this recreation theme was very important. Safety and crime was also important. So this is taken from AP News. There were 414 homicides in 2018. This is lower than in other countries around in the area, but there is some concern with that in the community. Community resources were also seen as something to be proud of, something to be excited about. This is a picture that I took of a modern art museum that I greatly enjoyed. One participant talked a lot about a community center that was recently established in her neighborhood, and how it was basically a place where mothers could take their children while they were going to work. And she was very proud and happy that that was part of their neighborhood. I also wanted to highlight some important quotes from our participants that kind of go against the deficit model. So many participants talked about how they liked living in their neighborhood. I want to point out this: I wouldn't see myself in another neighborhood. It's close to everything, my family, everything. They did feel as unsafe, but nothing happened to me. Progress was another thing that this particular participant brought up. They talked about change that's happening in their neighborhood, specifically a street that was recently paved. So this idea that a lot of participants talked about was that they love their neighborhood. They felt a strong sense of identity in their neighborhood. And that definitely goes against this idea of deficit frameworks. So the question is, what's next? Where do we go from here? I want to help improve our definitions of neighbor disadvantage, especially in the global South. I think it's important to take into account measures of neighborhood advantage, social cohesion, community resources, and access to parks. And I want to identify what aspects of those resources are helpful for child health. And I want to move into dialogues of empowerment and help make those communities strong and healthy based on the resources that they have. I wanted to provide some references for many of the articles that I referenced. And with that, I turn it over to Dr. Kasia Kordas.
Thank you, Seth. So that was great. I enjoyed your presentation. And before I tell you about the project or the study a little bit more, I want to because this is about building blocks of equity and the role that students can play in building blocks of equity, I want to talk a little bit about our work together. And I have to say that working with students like Seth is absolutely amazing, because he and other students like himself really push research in different directions, new directions. They dig deeper, ask really great questions that sometimes faculty or researchers who are on a certain research path don't stop to ask. And so they put an enormous amount of effort and energy and thought into these questions, and they really enrich that work. And so I feel that the work that we've been doing has really truly been enriched by Seth and what he wants to ask and what he wants to sort of drive to. So that's wonderful. And in this particular case of epidemiological research, not very many epidemiologists take themselves off to do qualitative work or to do mixed methods research, which is exactly the type of paper that Seth published. It was a combination of a quantitative study which was hugely enriched by qualitative work. And so I feel very strongly that doing that qualitative study enriched our understanding of the work that we do in Montevideo, but also really provided some questions that need to be asked, and that he is now asking about neighborhood disadvantage or neighborhood resources that, again, as epidemiologists, we need to be asking. So I really appreciate that. And so now I want to say just a little bit more about how this work for mi barrio, my neighborhood, fits into the broader work that we do with Salud Ambiental Montevideo. So this is this translates into Environmental Health Montevideo, and it's a long-standing multidisciplinary research program that we have. Gabriel is pictured on the slide, and our other colleague, Elena Quirolo, who co-directs the research program with me, sends her apologies, she couldn't be here. But we have collaborated with a number of institutions in Uruguay and around the world to ask questions about what are children exposed to, what kinds of environments do they experience, and how does it affect their health. Seth, can you go ahead and advance? So again, I said we're interested in different types of environments. We measure chemical exposures as well as the foods and diets that children consume. We're interested in all sorts of physical environments, distance to roads and parkways, or parks, I'm sorry. And that, go ahead and advance, fits into this this theme of the exposome, and that's the totality of exposures that children or actually humans experience from conception all throughout their lifetime, and all of those types of environments interact and intersect to affect human health. Go ahead. So in addition to the qualitative work that Seth has done, we've also collected quantitative data. We collect, when the children were in second grade, we asked their parents to tell us about their neighborhoods and answer questions for us that were questionnaire based. And this is data from about 80 of those responses. And for the most part, what we find is really interesting is that a lot of parents don't necessarily think that their neighborhoods are very good for raising children. Go ahead and change that. And some of the questions then that we ask them about their neighborhoods are things like they had to tell us whether they agree or disagree with statements like, people in my neighborhood are friendly, they're ready to help, they're very sociable, they take care of one another, they take care of each other's children. Another set of questions had to do with safety and crime. Another set of questions had to do with what the neighborhood looked like. It was clean, quiet, attractive, it was nice, it was safe for children to play outside. Then the questions that we asked were about resources and amenities. So things like, close by I have places to buy food, there's a good transportation system, there's good access to health services, there's a park for children to play. We also wanted them to talk about the streets. The streets are good for walking with family and there's enough green space. And I like walking in my neighborhood. And again, so it was a series of questions and they had to agree or disagree. Go ahead and advance. So based on these, Seth calculated these scores or factor scores that we called satisfaction, community spirit, community safety, and infrastructure. And what's really interesting is that safety doesn't seem to be very correlated with anything else. Safety is not correlated with satisfaction. It's not correlated with community spirit, whereas the infrastructure seems to be an important part of how satisfied people are with their neighborhoods. And community spirit was important, was correlated with how people were satisfied with their neighborhoods. So this seems to be, our data seem to be consistent with what the interviews are showing, is that yes, there is crime, and people are concerned about that, but it seems that more important than that is what people have around them and how they're able to utilize that for their daily living. And that plays into how satisfied they are with the neighborhoods they live in. And clearly the respondents to the interviews were happy in their neighborhoods. I also want to point out something that's important here is that 80% of the for 80% of the households, since the birth of the study child, they had moved only between 0 and 2 times, and about half the sample had never moved. And that again, I think is a clear indication of the stability of these families in these neighborhoods. And for families that we would consider to be highly mobile, and perhaps high mobility may be associated with poorer outcomes, only about 1% of the families reported moving 5 times or more. And so that's a little bit more or additional context for what Seth was showing with his data. And I'm going to turn it over to Dr. Barg to talk a little bit more about the context, because he is native Montevidean and can tell us a little bit more about both the neighborhoods and the research.
Thank you very much. In the first place, for the invitation to the seminar and to take time to think those matters, and obviously to the great presentations of Seth and Kasia. I just want to make some comments about the research of my neighborhood, but from the local perspective. Now, I'm now in Montevideo, Uruguay. So I would like to talk about this perspective. The first thing I want to say is that I'm very proud of being part of this research, not only for the published results and the innovative methodology that combines quantitative and qualitative approaches, but also for the way this research can impact locally. And I will only highlight three aspects. In the first place, I think it is very important to have a neighborhood disadvantage index. For many years, poverty in Uruguay was measured only by monetary income. In fact, in the last decade, the country, the government, made a great effort to increase monetary transfers to vulnerable families. But in spite of this, although families obviously previously to pandemic ongoing, but families managed to have a higher income, but they still suffer another form of exclusion in accessing education, culture, jobs, and other community resources. So it is very important to have a more comprehensive index than only income in Uruguay to produce better research and also to guide public policies with more accuracy. Another relevant contribution of the project, My Neighborhood, was that it gave people the possibility of speaking about their problems, their needs, their neighborhood, with their own voice and with their own point of view, literally through their photographs. I think this practice should be the gold standard for research with communities and also for public interventions. It is important in terms of the rich outcomes obtained, but this is more important because it promotes participation and strengthens local identity. Finally, as the research was about child behavior, I think another contribution is the idea or the fact that social factors such as community resources and security have a powerful influence in child problems. In a study we did some years ago about depression in young mothers, we perceived that one of the causes of the disorder is that they feel extremely guilty about the behavioral problems of their children. For example, ADHD symptoms. They are criticized by teachers or they are called by different institutions. So they started to feel very guilty. So it is very important to give context to these mothers and families, showing them that there are many causes of the child behavior problems, and the majority of them are social or part of the exposome, as Kasia said. For example, through the contamination with metals. I think this investigation is an example of an effort to understand the reality of vulnerable families of Montevideo with their problems and needs, but it also has several positive contributions to take action about those problems. So thank you again. Those were my reflections.
Thank you very much for kicking off with lots of questions that I'm still digesting and thinking, and I have a set of questions for everybody. But before I turn to the questions, I wonder if Seth, you want to react to anything that Kasia has shared or what Gabriel has shared? I want to give each of you a minute or two to react before we kick off into conversation.
Thank you. one thing that I would like to highlight is the criticism or that the mothers are getting about their child's behavior, and Dr. Barg mentioning that they feel somewhat at fault. I was wondering if you could comment a bit more on that. I think that that's a really important thing to emphasize.
Yes, it was some years ago we studied young women, young mothers from the west side of Montevideo, and we found a strong correlation between the stress in rearing and the depression, a highly predictive value of stress about parenting and the starting of depression. And one of the main causes of stress was feeling guilty or worried about the problems of the child. So they made the attributions that they were the main reason of the problems of the children. And as a general comment, the depression levels we found were higher than than the mean values in general in other countries and in other populations.
Kasia?
I was struck by the same comment actually, and thinking about how personal that feels for the research that we do to have to potentially provide that meaning for the parents. So I want to say a little bit more about how we share results with our participants. We have typically in the past provided, and Gabriel, please, since you are part of the sharing of the results, feel free to jump in and complement what I'm saying, or not compliment, but you know what I mean. Add to what I'm saying. So typically in the past, we would have meetings because a lot of our work is school-based. So we have enrolled participants from specific schools, and so then we would have meetings with parents. And here I mean the royal me, the study team, Gabriel and others would go back and share group results. So they would share, you know, these are the lead levels in children. These are the developmentally what we're finding, and that was really helpful. We have since then moved to sharing because everybody is now more advanced technologically than I am, but people have moved, do a lot of stuff online, and WhatsApp is a really important tool for communication. So we do communicate quite a lot with the families through WhatsApp and share our findings through newsletters. And so we shared Mi Barrio through a newsletter with the whole study participants to try to get their input and feedback into, you know, so how do the quotes from these participants, how do they square with what you're feeling? So sort of expand on the qualitative research that we had done. A plan that we have and are sort of working on gradually is to also provide a report to the municipality of Montevideo, because another thing that Gabriel, actually the first thing he mentioned was that previously neighborhood advantage or socioeconomic status was really just based on average income. And so here's a tool that may, in a more nuanced way, get at these other factors that weren't considered before. And you know, I think it would be, we hope that it would be useful to the city of Montevideo, and we plan on sharing those findings with them. I also wondered, as you were talking, Gabriel, about having a more comprehensive index, if you can talk a little bit about that a bit more. You know what went into the creation of the index, but I wonder, that index still, because it's based on the data that's available publicly from the municipality, they don't have things that we had, or Seth had presented as potentially being important, so that cohesion or neighborhood spirit or satisfaction, you know, that's not there. And I wonder if you can talk about the possibility of having access to measures like that, whether you think those should be part of that index. Because right now our index, even though it's more nuanced, still really reflects that more model of what's missing, or what may be negative rather than what's positive. So I wonder if you could talk about that a little bit.
Yeah, I think sure, it's certain the direction we have to move on. I think the first dimension we should consider is participation and include in the construction of an index the direct voice of people implicated. One of the attendees of this webinar, for example, my colleague Natalia Udelo, is working in a literacy index to have a more rich approach to education, more than only years of school, and going through real, actual learning. So I think it is difficult to include all the dimensions of poverty or vulnerability, but I think if we develop several indexes that include both negative aspects or deficit aspects and capacities and strengths, we can develop a kind of measure like that. It is difficult. It is more difficult to quantify good things than bad things, as Seth told in his presentation. But collaborative work and the inclusion of the communities that participate is a good starting point.
Fantastic insights and so many questions you've added to my pile, but I don't want to glom the time because this is just great. I guess this is a model for what happens when you have colleagues on the same call. Seth, do you have another question or follow-up? Otherwise, I'll launch into mine. And I'm also inviting our guests who are dialed in to drop their questions into the chat, please.
Well, there is something that I would like to ask, and it has to do with the history of Uruguay that I'm not familiar with, and I'm really curious about what particular policies you think, Dr. Barg, led to some of these differences in advantage in different areas of Montevideo. We talk about redlining in the United States. In Uruguay, you know, what kinds of things do you think led to these outcomes that we're seeing?
Do you mean the difference in the city, in the different neighborhoods, between the different neighborhoods? Well, the origin of Montevideo was near the coast. It was the original city, and during the following years, people from outside, from the farms, from the other parts of the country that didn't have work in the fields, started to go to Montevideo and establish in the belt, in the outside belt of the city. So those neighborhoods are the more poorer. They have the little infrastructure, and during many decades they live in really bad conditions. Only in the past 2 decades there was an effort to increase the conditions and the general infrastructure. But this reality is not hasn't stopped. It is continuing, so it is a big problem, and it's a problem that is bigger since the COVID event.
Thank you. I would love to talk more. Yes.
I was actually curious about history, and Seth got us going there. So typically when, so Gabriel, just so I can place you can contextualize my questions. They come from a place of interdisciplinary work, and many of our colleagues dialed in are from different disciplines. They're not all epidemiologists. So some of my questions might sound like they're from left field, but they are really from left field. They're from outside the discipline. What I have a bunch of questions for the three of you, and anybody can answer whichever way you want to go. You know, I was struck by the very, very clear and insightful departure from deficit-based research just from the opening of your panel. So Seth talked us through the different ways in which we can frame questions. And this particular series is about how do we build capacity of students to deal with questions of equity. And my mind went immediately to how are we training students in methods so they can actually do the difficult measurement. Seth started that, and then Gabriel just ended that by saying, well, it is difficult to measure things that are positive. But then I wonder, conceptually and theoretically, we understand that social phenomena are complex, public health phenomena are complex. But when we come to the measurement part, things collapse a little. And it's in the collapse of the measurement that we lose that complexity that is life. And so I wonder if we might spend, or I might hear from you, your thoughts on specifically what are the challenges of putting together indices that just sticking with quantitative work. And we may not have an answer today, but I wonder if we might spend a little bit time thinking about the criteria of how to develop an index of neighborhood disadvantage. Because I heard hints of it, it whetted my appetite for more. And so I wonder, so then the follow-up to that is actually a question for Kasia and Gabriel, which is how do we train students in methods courses so that equity is not the preoccupation in the theory courses. It's not the preoccupation only in some seminar on the side, but it needs to filter through both the theory, but also in the method. But let's do the neighborhood disadvantage index first, or neighborhood advantage index, the neighborhood index. Like, what are the challenges from your point of view? Kasia, you mentioned, well, one was that it's easier to measure the negative things than the positive, the absence versus the presence. Then one of you mentioned that there's no secondary data available for some of the things that you know would contribute to a more nuanced index. So that's 2. And what are some other things that you struggled with in developing an index? Anybody?
Seth, take it away.
These are all thoughts that, I mean, my wheels are spinning, and I'm thinking about these. I'm thinking about methods courses that I've had, and how many measures, not just neighbor disadvantage, but how many measures are based in these deficit models, and aren't based in strengths of either the community or the person. So that's just a thought that I had in general. Something more practical that I've thought about is that some of these community resources aren't available at the government level sometimes, but things like access to a park is different than the percent or number of persons within a predefined boundary that have or don't have something.
Mm-hmm.
To me, it's hard to define. You would have to, and I'm just kind of spitballing at this point, you would have to define access to, as a resource, access to a park by maybe the density of a park within each predefined area, or the distance to a park from a predefined area. And then how we define those areas too is important. And, we rely on the government to define those areas for us. And maybe we don't want that in how we're creating our measure. Yeah, I'm just thinking out loud right now. Yeah, I would love to hear from others.
What about you, Kasia?
So, yeah, this is such an excellent question. I think a lot of the measures that we use are very reductionist, and we try to find, variables, a set of variables, let's say 4 variables, I'm making that up, that we think distill the issue to its core. Because then we think that if we can measure just those 4 variables, it will explain a lot of the noise, the variability that we see in the data. And the reason why we want just 4 variables is that it's really difficult and time-consuming and expensive to measure 40 instead of 4. And so we come down to these reductionist measures that we then critique because they're not sufficient, and they take it from the deficit model. And so just to explain how, where we take our measures. So we have the family's address, we can geocode it. And then what's really nice, and thankfully it's available to us. And I think in a lot of cities in countries south of the equator, this might not even be available.
Right.
But what we have is, based on census data, based on the data that the municipality of Montevideo keeps, we can pull that off the internet. It's freely available to us. And so we're essentially taking the data that exists, that was collected, and we count ourselves lucky to have access to that. Mm-hmm. And then what we get are reams and reams of measures. I forget how many variables you were able to get, Seth, is it 30 or 40? And then we
More
start
all the time.
looking, yeah, and we start looking at them and thinking about, well, do they make sense? Do they fit with the definition that exists, which is the Samson definition? And so, we try to line them up and see, well, we have most of them, but don't have some. And then, we calculate, the first pass is the index we calculate, and then we think about, well, but is this sufficient for what we have, or is it sufficient to explain what this city is like? And that's when we start looking at other measures and saying, well, maybe those are the ones that we include. And it's a really interesting process, but the problem is that there is no validation. I mean, what do you validate that against? It's still our word against, another index. And so I think that the challenges are just so numerous. First of all, it's access to data, it's access to information that's current, but then also thinking about, how do we actually validate these measures, and do they measure what we want them to measure, or do they measure what's really meaningful? And so, yeah, that's a huge challenge. So I'm gonna just stop there.
Really, really fantastic. You're not pushing for an answer, but you're raising a lot of great questions. Gabriel, would you like to add?
It's a really interesting question, a very difficult question, and I'm just thinking in two concepts that we can apply. One is the concept of health. I think the health has many levels, from a biological level, social level, and emotional level. So I think it's a framework I like to consider when trying to answer these kind of questions. And the other thing I think it's very important is considering people's perception, not only facts, but also how the way they perceive those facts, because many times, for example, they have a resource in the neighborhood, but if they don't perceive this resource as something that they can use, something that is their own property, they don't use, and they don't have a real impact in their lives. So I don't know exactly how, but perception should be another component of this ideal index.
Yeah, thanks for bringing that up. We actually had somebody dialed in earlier, I don't know if they're still here or not, who showed in the US context that it's the perception that drives behavior, at least, if not health outcomes. This is Jordana Maisel's work that pertained to that. A second question that I was, also I want to go back to validation for 2 seconds, Kasia. I recall that in a study or a project in Buffalo where we were running into this question of which variable to use, we experimented with talking to community partners about and residents about picking a particular variable, and that did not yield any smaller focus either. It got actually very complicated. So it's just a very difficult task that is ahead of us. The second question that I had was, and then I have one last one. The second question I had was about, maybe this is tied to perception, but when the three of you were presenting, you were talking about sharing information back with your participants, which sounds phenomenal, by the way, like sharing results back with people who are in your study. But I wondered if you have thought about, or if you think there is merit in the use of some form of citizen science or phone app that generates the kind of perceptual or experiential or positive data. So I wonder if one of the things we are struggling with as scientists and researchers is that somebody is gathering the data, but it's not people providing the data that is meaningful to them. So I wondered what you thought about neighborhood-based data provisioning. So in the US context, for example, in the city of Buffalo, there's a 311 app. So if you see a pothole, you take a picture and you push it up, and it generates data, point location data across the city of, unfortunately, problems, not, I love this tree, here's a picture of the tree. But I wonder if you have thought about that kind of data generation that's both meaningful, precise, on time, and that would inform your work. What are the pros and cons of that?
Gabriel, do you have thoughts that you'd like to start with?
I totally agree. It is an amazing idea. In our sample of families, for example, they almost all uses the WhatsApp application. So starting to explore online communication and live communication, I think it could be a very rich channel to access to their thoughts and feelings.
So I think that a citizen science project like this would be amazing. And I think it would provide a lot of context data. When we were trying to figure out what the sources of data for our project were going to be about neighborhood quality, I did consider, and I think Seth and I had this conversation about Twitter. And wouldn't it be amazing to try to access Twitter data? But that would be a dissertation in and of itself. And at some point you kind of have to say, okay, we just need to move on. But so we have considered other sources of data. I know that Montevideo has had some kind of a satisfaction survey conducted, and if we could have access to that, I think we would love to, or sort of, but one potential problem with using data like Twitter is, as you said, Samina, some of those social media are not necessarily used to point to positive, but may be, again, pointing to negatives. And so having a separate project that's really dedicated to people commenting on positive aspects and rating positive aspects of their neighborhood, I think would be amazing. And what we would want, even though our participants are spread across specific neighborhoods of Montevideo, I think we would want a citywide study so that we can then put what we have in our own research in a broader context. And so, yes, I think that would be great.
And Seth, do you want to add?
Thank you. I was remembering that this is actually an example of another problem, but in research. But we were thinking about doing systematic social observation of the streets, potentially even using Google Street View, which is available. But we just realized the complexity of trying to categorize in another context, take a measure that is utilized in the US and applied to another culture, another area. It's just so complicated. And I talked with Dr. Barg. I walked the streets with Yanina Cayo and Elena, and I think we could come to the conclusion that, at least for this immediate work, using that kind of data would be difficult. But who knows? Maybe in the future that could be something.
Yeah. absolute local context, I think, has to inform, along with history and everything else that we've discussed, what we measure. That's a perfect segue to the next question and insight that's coming from one of the attendees, Dr. Corey Smith. I'm going to read it out in case people are not able to read. And he says, building upon the conversations about the limits of definitions and techniques and Samina's question about research methods, in global health, a common saying is, what is measured is what is done. Choices about what is assessed, excuse me, for example, poverty, heart rate, water quality, happiness, etc., drive interventions and therefore outcomes. Of course, it points to an upside down approach in our thinking, but it also points to gaps in inductive and deductive research methods, the need for finding new techniques capable of uncovering hidden intersectional phenomena. I wonder if techniques that are even more deeply inductive, even idiosyncratic, may offer insights to inform more sophisticated quantitative models. I have a reaction to that, but you all are the panelists. So maybe starting with Seth this time.
Yes. Yeah. Well articulated. I think that I would love to be able to, and my mind is so quantitative, so I just go to questionnaires right away. But it would be, I think, very beneficial to develop a social capital or social cohesion-based measure that we could apply to get at that. But I do want to echo the fact that our quantitative methodologies are limited, and while it's helpful to express things in numbers, sometimes that can be problematic. Yes. Other thoughts?
Gabriel, would you like to go next? And we'll go to Kasia last.
Idiosyncratic methods sounds good for me because I usually work in neuroscience. So we work a lot in one brain of one person, and it takes us a lot of months. I agree that it's an approach that it's very fruitful. Again, I think there are different levels. We have a more biological or neurological level, and social level, and also an affective or emotional level. And yeah, I think in all this level, it's important to deepen in one person or in a few person, but go deeper. It's not contradictory such approach with a more statistical or social or with big samples or cohorts. I think it's complementary. It's enrich the view, the perspective.
Great point. We need it all. Kasia.
Yeah, so thank you, Corey. I really appreciate what you said. It resonates with me what you said, that the choices about what is measured drive interventions and outcomes. Completely agreed. I think a lot of our research, our own research included, is researcher driven. It's not community driven, and therefore we point to things that we feel are important, but sometimes that's not, it's not the way it should be. Sometimes those things coincide with what the community feels is important, but sometimes they don't. And I think that we as researchers need to put a mirror to our own motivations and actions and you know why we do the research that we do to get it to really make a difference. So I'm not answering your question. I'm kind of reflecting on what you had said in setting up the question, but I think it's equally important. And yes, I agree that different types of techniques may be needed. I'm not sure, again, as a quantitative researcher, you know, how do we actually implement that? And I'm not saying that it's not possible. I just wonder, and I'd love to have further conversation about that. How do we actually go about doing that and implementing that so that it both is reflective of the reality and that we can, you know, later quantify it and measure relationships, associations. So I actually, I welcome further conversation because I'm interested in how to do that. So anyway, that's not a perfect answer, but there it is.
It's a great answer. It's actually an opening. You just opened a door, Kasia. All three of you did. It strikes me, following your comments and Corey's question, that there's often a conversation about how disciplines need to work together. And certainly our existence at CGHE is testament to that. We have different disciplines represented right here. I think maybe what this is reminding us about the importance of a representation of multiple methods to answer a set of related questions. And that might be where we go with Corey's insight and question 2, which is that we need to have we need innovation and exploration of how can we deepen the methods. So why don't we have ethnographers working with epidemiologists in the same neighborhood? And what does that look like? I know that some of the best work that I enjoy, I have seen that happen, but it's not the norm because our disciplines and higher education is not set up to support that. But maybe an opportunity for future is to think about that methodological synergy. Corey is throwing in some ideas, facilitated deep autobiography. I happen to know in my work on food that there are qualitative colleagues that are walking in a store with people as they're making purchasing behaviors to understand what's going on in their daily life. So it's kind of like it's not an autobiography, it's the equivalent of shopping with somebody to pick up what their experience is as they're going and doing it. So lots of options here. And perhaps this sets the stage for a future CGHE series, which we can focus on methods, equity in methods.
Yeah. So if I could just kind of bring this back to the question that you had asked, Samina, how do we train students? So a thought that occurs to me is that as we, you know, train students, for example, as I train students in epidemiology, the conversations that we have are, you know, do you understand what's been done before, or how are things done, or how have others done this in our own field? And so, right, you know, understanding the canon in our own field, but maybe we need to broaden the question and think about, well, how is it done in other fields, or how are other people doing this, and talking to, you know, looking at other methodologies, looking at other researchers and from other fields, to really think about, you know, maybe our methods aren't the best. Maybe we need to get out of our own little area.
If not, so, I don't know if I would say not the best, but maybe they are not the full set of methodological choices that are available to us. So you have brought us to the tail end of questions, which I was hoping to hear from all three of you, where you sit in your stage of the career. So for Seth, looking forward, what is it that you would want to hear from either Kasia or Gabriel about looking back? What might enable you in your trajectory forward? What's the future that you are imagining, and how might these two colleagues answer? Like, what are some questions in your mind? And as an early career researcher, what are some things that you wish your faculty had known, or what your, don't point to Kasia, but more broadly, what is in your curriculum that you would advise your peers? Let's take it in this direction. What would you tell your peers, PhD students, about what to think at your stage of the career so that they can center equity in their work?
So if I could repeat the question so I know, the primary question is about how can students apply and rethink about definitions in the discipline of epidemiology? Mm-hmm. Okay. Yeah, I had a couple thoughts. One is, I think that we don't talk about epistemology in epidemiology. I don't think that we talk about how do we know what we know, and that there are various methods of inquiry that are equally valid based on work in epistemology. And I think that recognizing that in the discipline might help open the door to acceptance of other methodologies of inquiry from other disciplines. And I think that would be really helpful. As far as definitions and equity, I think what I would say is that I've learned so much from the team in Uruguay, from Salud Ambiental Montevideo. You can't do research in a vacuum, and it's been those partnerships that I think that have made me a better researcher and a better person in general. So I think encouraging students to have those collaboratory relationships is important. Does that kind of answer what you were thinking? Okay.
Yeah, that was great. My question was wandering all over, and you tightened it like an epidemiologist. Gabriel, you have a record of working with these amazing colleagues, and clearly you seem to enjoy it. And I'm wondering what advice you would give to faculty who want to embark on this kind of work and center equity in measurements. You already gave us lots of insights, but I want to hear advice for faculty from your end.
I will answer mainly considering faculty in Uruguay or in South America. I think what is very important is to have to develop a more scientific thought in the better and broader sense. I mean, it doesn't matter if you choose a qualitative or a quantitative approach, but thinking about things in terms of causes and consequences and linking phenomena. This is the first things, and the other are the means to achieve this aim. And I think we need to struggle a lot to form ourselves, to learn methods, methodology, and be in a have a good level, a good quality of level in science, which is sometimes difficult in South because we don't have even the teachers. I have the huge lack of working with Kasia and with Seth and all our team, but many times we don't have even not the resources, but even the teachers. So I think this is an advice that try to go together with researchers that can offer and train in those abilities.
Thank you, Gabriel. Dr. Kordas, last but not the least, what advice do you have for faculty, definitely at UB, but perhaps more broadly, about how to mentor students and how to work with partners so that we can build these blocks of equity?
Well, a couple of thoughts, and they're probably going to be jumbled and not complete. But so for students, I already, when I was speaking about my work with Seth and other students, being really open to their ideas and you know, going on wild journeys because they can be incredibly fulfilling, very fruitful, and very educational, and recognizing the strengths that students bring, both in the discipline that you happen to be in, but also outside of that discipline. And for working with partners, being ready, if that's possible, for the humbling journey that it is, but humbling in a very good sense, humbling in a character building way, in friendship building way, in ways that make you feel amazed and lucky to be working with these people who are so thoughtful and passionate and knowledgeable. And so, yeah, I guess that I would say that.
Well, that was a great conclusion to remind us about the benefits and the gifts that come from such work. Thank you, Kasia, very much. And thank you to all three of you for this great conversation. With this, we will conclude our webinar with a reminder for guests that are still dialed in that our next session will be on November 18th, led by Dr. Tia Palermo, who is coincidentally also in the Department of Epidemiology with her partners from other institutions. Please join back on November 18th. Thank you very much and have a wonderful evening.
Thank you so much.